Hi everyone, so we are back on this Damn Siri YouTube channel, this time with a very important question that lot of medical students have asked us. And I'm sure you already have the hint with you when you see Dr. Mala on the screen, that today we are going to talk about the American opportunities for Indian graduates. And not only opportunities, we will try to dissect in simple words, in simple language, the entire pathway. I keep seeing a lot of our juniors from different colleges, a lot of students who would say, okay, what are the pros and cons? Why should we go to America? Why we should not go? What are the exams we need to give? What are the opportunities? What is residency? What is fellowship? What is clerkship? What is rotation? There's so many words floating around. And we will try to do it in a non-technical way, in a very candid way. And to solve it with me today, I have Dr. Mala Srinivasan. I'm sure many of you who are following our Damn Siri channel on YouTube, you already know her. She's a renowned mentor for USMLE and US residency opportunities. She has been around this field for last 2 decades plus. And to the best of my knowledge, on the Indian subcontinent, we don't have anybody else who is more experienced in this field. So with that, Dr. Mala, let's start off with the beginning. What should be the stage? At what stage should a medical graduate think about it, and what should be the first steps?
Okay, so firstly, thank you, Dr. Sumer, for this opportunity, and I'm honored that you called me here and we can talk to students so candidly and tell them in very simple words about USMLE. So first things first, it's a very apt question, and I think 90% of the students, they come with their parents and they say that they come as soon as even before entering medical school, and they say we want to know when should we start USMLE, especially with the new changes and everything. They are scared, they don't want to miss out any opportunity. So it's a very right question. I think from day one, they should first of all know that they need to go to the US, because the people who start from day one of their medical school are the ones who 99.9% of times who manage to get there. That's been my experience. The second thing I would say is the second year is actually a very ideal year to start, because the subjects that are involved in USMLE step 1 is microbiology, pathology, pharmacology. All of these subjects are of high yield in your second year. So starting in your first year studies for USMLE becomes a little bit difficult for a student, because they do not relate to the subjects that are taught. But what you can do in your first year itself is that start getting into extracurricular activities, start getting into research modules, start getting into volunteer activities and things like that, which make your CV look very strong. So I would say first year से ही start करना है हमें, लेकिन second year में आपकी जो academic that would change in your second year, and you need to start studying for USMLE step 1 in your second year.
So, I hope, the listeners would understand and follow that what Madam is saying is that you need to start thinking about it early, and as early as possible. And Madam has actually mentored students who have actually started from day one of their medical school. They were clear that they want to go to America for their further education. Absolutely. And before, we dissect it further, what are the things that would attract Indian graduate to further study in America?
Okay, so what are the things? See, firstly, I would say lifestyle change, because you're used to, struggling it out a little bit in our country. So I would say the pros of US is that ease of lifestyle, I think. From the very first year of residency, they start having their own house, their cars, they live in a world which is definitely, when you start studying for USMLE, when you go into a residency, the options multiply for your fellowship. Your training schedule becomes very different. So if students want to just train and come back, that option is also there. So I think the first thing that excites students, which mostly I have seen, is that they want to look for a particular college, or they've heard of, say, Harvard or Hopkins or Cornell, ऐसे बड़े-बड़े नाम सुन के they feel that we also want to work there, which is very possible. When it becomes feasible and you realize you earn more, you are in a better, convenient state where you don't have to worry about small things. Well, there are cons also where people say we miss family and we have to stay away from family for a long time. So the pros look like more for people who want to go there, and that's when they decide.
And the first step towards this dream career in America would be giving the step 1 USMLE, and we have seen a lot of changes happening in the step 1 pattern as well as the outcome. You used to have a score, now we have a pass fail outcome. So I would now ask Dr. Mala to tell us about the preparation for step 1. When should it start? And even more important, when should one give the step 1 USMLE? What is the ideal time to give the exam?
Yeah, that's a perfect question, and I think this would really be useful to students who are entering into medical school with an idea of getting into US, or who are already in the first year or second year and they want to know what would be an ideal time. So firstly, very importantly, step 1 needs to be given in your third year. That is the earliest you can give your step 1 is in your third year. So the preparation for step 1 should start in early second year, and early second year I mean as soon as you finish your first year exam and you've started your second year medical school, you should start looking out for either courses or help to somebody to mentor you for your USMLE step 1, because if you give your step 1 in your third year, early third year, it helps you in the following ways. One, you are done with a very important step. It has become a pass and fail. Even though it is a pass and fail exam today, it is extremely important you perform well in that, because a step 1 paves a way to a step 2 CK. Step 2 CK scoring is extremely important today because there is only one step score that is going to be counted for you. So if you do well in step 1, 80 to 90% of chances are that you will do well in CK, because there is so much overlapping of subjects of step 1 as well as step 2. It's a very clinical based exam, that's why. The second advantage is that you are fresh with your second year subjects. It also helps you with your college curriculum, because patho, micro, pharma, these are 70 to 80% of the questions are asked from these subjects, which are your second year subjects. And finally, the third and the most big advantage that you will get out of this is when you actually apply for your US clinical electives, which is a mandatory thing, in the steps, maybe towards the end I'll just tell you few things that are mandatory for USMLE. US clinical rotations are extremely mandatory, and if you have a step 1 score, then applying for them becomes easier. You get into better places with a step 1 score, and in your final year or at the beginning of internship you can apply with a step 1 score. So third year, along with third year curriculum, you should try to give your step 1 exam.
So summarizing, giving the step 1 in early third year would always give you the advantage, and also today the medical education is all integrated. So if you're good at your basic sciences, the clinical sciences, the
Absolutely.
CK, step 2 CK becomes easier, and you actually score higher if you are good at your basic sciences. And I think Dr. Mala has already touched upon some things. I'll ask her to elaborate that. Now if I, as a candidate, if I appear for my step 1 in third year and then I want to time my step 2 CK appropriately, when should I be doing my step 2 CK? And because it is the score that is going to matter. So what should I be doing to score high in the exam?
Perfect. So firstly, a small rough timeline for any student if you're starting in your first or second year for USMLE. Start your preparation for step 1 in your second year. Give your exam in somewhere in the middle of your third year before your final third year exams. And in your final year, you will have to probably give your next or NEET, and you have to make sure that you are doing your curriculum, because final year is a very tough year for students. So we skip straight away to the internship year to finish the rest of your USMLE journey. As Dr. Sumer rightly said, having a base of step 1 really improves your chances of doing well in your CK. Plus you have your final year curriculum which you would have just finished. So doing it in early internship would be a very ideal time to give your step 2 CK. But you also have time to go for your rotations during your internship only. Alright, so apart from step 1, step 2, very importantly today in the US is doing rotations in the US, and that can be done only in your internship year. So whenever you're going for rotations, you can time your CK either before you go for the rotations or even after you go for rotations. So this comes after your step 1. You can start working on your CK immediately, but you can give it according to the availability of slot depending on when you go for your rotations.
And you have already touched upon and you started talking about rotations. How important is doing rotations today in your final residency matching, and like what really matters? Like earlier we used to say high step 1 score would be the first step, but now the step 1 does not have a score, it is pass fail. So what really matters, what should be the components out of these three, how should I as a student think about it?
Absolutely, this is a perfect question, and I think it's probably most, if that is the take home the students can take from this video that we are sharing, I think that would be great. So just 4 things on your fingertips. A step 1 pass in your 3rd year would be ideal. These are only ideal situations. When I say that you should do this, doesn't mean if you don't have the opportunity to do this, you will not get into a residency. But I'm telling this for students who are beginners and who feel that they want to get into USMLE. Try to give your step 1 in your 3rd year. Give your CK with a very good preparation, with aiming a very high score. Apply for your rotations somewhere in your final year, and make sure that you go for your rotations during internship. As Dr. Sumer asked, why rotations are important? Today there are only 4 things that a program director, if America mein you apply for any program, whether it is internal medicine or surgery or radiology, जो भी subject आप apply करते हो, सबसे पहला वो आपका step 2 CK का score देखेंगे. That would be your filter. That will be a filter which will filter out all the applications, because you know rightly that there may be 200 applications for say 12 seats or 15 seats. So how will they filter it out? अगर step 1 pass or fail हो जाता है, the only way they can filter it out is through your CK score. So CK has to be a great score. So, and you have time during your internship to prepare for it. Secondly, they look for letters of recommendations from US. You need to have letters of recommendation from US, which can be done through electives, which are hands-on rotations. It can, suppose you say that, oh, my college is not giving me permission, I cannot do hands-on, I cannot break my internship, then you should at least try to go for observerships, externships. Maybe in some other forum, maybe in few weeks from now, we will again have a small session where I can, give detailed explanation of how you can apply for rotations and what are the different kinds of rotations. But importantly, you need to know कि आपको वहाँ के letter of recommendation would be the most important thing after your step 2 CK score. And finally, the third and the most important thing, you have to be a fresh graduate. जितना जल्दी after your internship you apply for your residency, that early they try to absorb you. They prefer fresh graduates.
I think Madam has answered a very important question that I have seen many people ask, that when should I think about going, at an early stage of my career or later? And I think you've already answered it. Earlier the better, because they would feel that a candidate would get absorbed in their system, adapt in their system more easily at a younger age.
Yes, that's right. They somehow like to pick and choose youngsters from here, because also they assume that if you are coming late, this was not your first option. You're coming late because आपको ये बाद में सूझा कि आपको US जाना है. You did not think of it before. So they are looking for people who are more connected and want to go to US, right?
And like suppose I am a candidate who wants to prepare for USMLE, and I know, ma'am, you and me and all of our teachers together, we have created and curated a course for step 1 as well as step 2 CK on the DAMS platform. Any things that you want to share about the DAMS course on
Absolutely. That is the most important thing I would like to say, that at the cost that we are offering you live teachers, at a cost that we are offering you live sessions with some of the best teachers in the country. As Dr. Sumer rightly said, that we have a wonderful course that we are putting, when we had COVID, when COVID struck, and we did not have the opportunity to give students a live, face-to-face sessions. We started with Dr. Sumer's mentorship, the online e-medicos app courses. So 3 days a week, you will have teachers, coming online for the live classes, and these will be for a 6-month or a 1-year session. Usually for a second-year student, we prefer that you take a 1-year session, so that we are hand-holding you right up to the end when you are taking your exam. We also have very interesting things which students felt was very useful for them. We started a WhatsApp group with all the students who enrolled with us. So we have close to 200 students together on the WhatsApp group, and it is so nice the way they handhold each other. There are some seniors who will answer questions to the students. You feel like you're a part of a community. You feel you're a part of a group, which sometimes for USMLE you never feel, as everyone knows that USMLE is जहाँ 100 बच्चे अगर PG देना चाहे तो 1 या 2 बच्चे होंगे जिनको USMLE देना होता है. So when you come to a group or a community like this, you feel belong. You feel like you feel more energy. I think the mentorship of not only me, the teachers, as well as all the other students who are there in the group, it becomes a part of your your journey. So I think these are the few highlights. Of course, our step 2 courses for CK are going to start very shortly. Hopefully within a month we'll be announcing the dates for our CK Live. We already have it on the app as video lectures, but we will be starting the live as we discussed recently.
So as of now, on the eMedicos app by DAMS, we have step 1 live classes, which would be all integrated clinical teaching, and not only that, even I am doing a radiology session for the radiological anatomy session in that course. We are also covering the hidden areas for Indian graduates like behavioral sciences, which sometimes they are not exposed to in our medical education system. And also we have a very unique feature in our course, which is different from I think any other program, that we have tests for student periodically with a video discussion on the test also. Because what I have learned is the students in a paper like USMLE, where they are trying to test your concepts, your application, some students are able to pick it up theoretically, but when they have to apply on the questions, they struggle. So we have synthesized together a course where we are dealing with the theory as well as the MCQ skill together in a course. And rightly, as madam has already said, that we have step 2 CK courses also, and soon we are going to launch a step 2 CK live course also on the eMedicos app. Our goal is that, and I think it is something that madam has said and is very important, that suppose you are from a peripheral medical college and you are the only one who wants to prepare for America, you might find yourself lonely. And when you come to a course like DAMS, we create a community, and that is what we have done in our NEET PG segment also, in our dental segment also. We have created communities where we do, not only the teachers and the mentors would do the hand holding, the community itself starts to inspire you.
Absolutely.
And I think that is the goal of DAMS in the USMLE segment. We want to make sure that all the international graduates, we have had actually students visiting our courses when we were doing in the pre-COVID era, we were doing it face to face. We would also try to restart the face to face version also.
Absolutely.
And at that time we had students from US also visiting, and
now on the app also there are from Caribbean, from US. We have a lot of people from even Nepal, and so many countries. We are now connected with a lot of other countries as well internationally, which is
and as compared to any other program, what we have seen and what we really try to do is we want to handhold the student, and we want to tell him A to Z, like what we don't work with any assumptions. And I have seen in very different programs that a lot of teachers would have an assumption that the student must know this much. We teach with no assumption. We start with the basics and then we go up, and that has been the DAMS mantra throughout.
That's right.
And what is another question, like you've addressed the issue of residency. What about fellowship? Suppose I have done my MD in India, I just want to acquire a skill and I want to come back to India later on. Do I need to appear for USMLE, and what are the fellowship opportunities?
Yeah, that's a great question. Yes, you do have to give USMLE for validating your MBBS degree. So anyone who needs to go to the US, whether you are even MCH or DM in India, your USMLE has to be given all the 3 steps. You have to be ECFMG certified. So you have to give step 1, step 2, and in the current scenario, OET instead of CS. Pehle CS tha, where clinical skills ke liye you had to go to the US and come back. But right now it is OET, which is like a TOEFL exam with a medical base. So they have to give all the 3 steps even for a fellowship. The fellowship opportunities are multiple and great in the US. You can certainly go there for a 1-year, 2-year, 3-year fellowship. You can do multiple fellowships also once you clear your USMLE. It's a little more easier than the residency process. If they are not giving you residency allows you to practice in the US, but after a fellowship, you have to come back to India and you can practice with a much better opportunities in India itself once you finish your fellowship there. So MD is mandatory because they need to know your background, they need to know what kind of work you have done in your country, and they definitely check your publications or good letters of recommendation similar to residency, but fellowship is a little more easy and they need to give USMLE for that, as you asked.
And any particular ideas or any particular suggestions you might want to give to students regarding the visa? I have seen some students would come to me and say, I have had visa problem in the past and all those. Any quick thoughts on that?
Yeah, definitely don't take the visa lightly is what I would say, because ultimately your entire journey depends on when you apply for a visa, you have to do it professionally. We do have a lot of people, at least some people associated with us who can help you with the visa. But other than that, whenever you apply, please do it with a lot of thought in it. Don't just knee-jerkly go apply for a visa, go without proper preparation for your visa interview, because I think your entire journey rests on the fact that what you present yourself as to the visa officer. So take professional help for it. I think that is the most important help you will do for yourself, and apply in time. You need at least 4 to 5 weeks of planning before you apply for a visa for rotations, and definitely we mentor you for the entire process. I can at least tell you or mentor you for the process of visa, but we can also give you professional help.
And that is the difference between DAMS and any other course. Like what we do is, although we have people studying with us in the step 1 courses, step 2 CK courses, but they would have many other questions about the career in America, and we keep answering.
Okay.
And also, I like to add here on a personal note, even Dr. Mala's daughter is doing her residency in America, so she has seen it firsthand what life in America actually feels like. Is there something that you would like to add? Like we've seen the rosy side of it, but I've also seen some students have come back to me and said that, sir, I felt lonely there, or I missed my family, and they came back. So, like I'm sure you must have been given these questions by many students in the past. Is it a personal thing, or how should a student approach the pros and cons? And do you think doing a rotation also helps the candidate to understand what America is all about?
Yeah, it's a very, very valid question again. And as you rightly said, I think always when you want to try something, if the water is hot, you put your finger in it first. You don't just put your entire hand. Even if the tea is hot, you sip it slowly, right? Similarly, anything, if you're planning your life in the US, you need to make sure that you do small steps towards the US. Firstly, I would say go through professionals, go to people who have already gone there, so that you are aware of the journey. Many people come and tell me, my friend said it is useless, you don't get surgery, so I don't want to go. So you go to a wrong person and you ask wrong things. So we say, ask the professionals, ask people who know about the journey, or people who are already there, and find out the pros and cons. If not, going to the rotations, as Dr. Sumer rightly said, going to the US, take a 1-month rotation, pay for it, go there, do that 1-month thing. That is all you will have to spend. Once you go there, if you like what you're seeing over there, you will feel more energetic to work towards it. But if you don't like it, then that's a good time for you to come back, rethink your options, and come back and start working, because India में भी बहुत सारे options हैं, बाकी countries भी हैं. There are so many other countries. US of course is a very streamlined options. So as he said, sometimes life gets lonely there. Sometimes what you expect, I had a student who got into Cornell, into gynae, and it's a very, very tough branch to get in, because the surgical branch, getting into gynae in a Ivy League college is extremely difficult. But after she went there, after 1 year of doing that, she felt that this was really not her calling. And this, like you said, could be a personal choice. It could be an individual's opinion. She felt that this was not, because her mother was a gynecologist and she had seen a different life as a gynecologist in India, and she decided to come back after she achieved a very impossible task. So it sometimes happens like this also. It doesn't mean that जो भी US जाता है, they're very happy about it. There could be changes that you may want, but I would say try it before you enter a residency rather than do it.
So, if I say it in easy terms, rotation is like dating. Yes. You get to know the system, they get to know
Absolutely.
you. So before you finally get married, it's important to date. And is there any residency, or like if you must be following all the data and everything. So do you think during the last match, IMGs matched into some particular specialties more than others? And like you said, obs and gynae is difficult. So which are the fields which would be difficult for IMG to get?
Yeah, so I think any surgical branch is slightly more difficult to get in. When I say difficult, the process is extremely lengthy. It has to be very, very well thought of. I have students who come to me after internship. They have finished their internship and now suddenly they want to do surgery in the USA. So, when you come to that kind of a situation, then I say, when you had to do surgery from first year onwards, you should have started, working on your CV, started doing something. So it becomes a little difficult. yes, surgical branches are tough. Radiology was thought to be tough, but our own very student from DAMS was among the first few people to get into radiology in a very competitive medical school. So I think all fields are open for people. Some fields are a little more competitive, hence you need to make your CV strong. You can't say, अच्छा ये difficult है तो मैं नहीं करूँगा. अगर आपको वो करना है, you have to start from day one. Right from your 12th standard when you get into medical school, that's the time you have to think of your options and make sure that you do that. But internal medicine, pediatrics, maybe neurology, pathology, radiotherapy, these are all much easier branches. Not easier, but these are branches that you can get in if you have the right scores, if you have the right CV. Like CV means research kiya ho ya wahan jaake you have done your rotations, got good letters of recommendation. These are all easier. Pediatrics, family medicine. Basically, these are the places where most international Indian students match.
And I like to add here, don't get discouraged by the competitiveness. It is there in India also. Like if you want to get into a branch like radiology, dermatology, even in India it would be competitive.
It is, exactly.
So don't use this as an excuse that I want a particular branch. It is tough to get in America. It might be tough to get in India also.
Absolutely.
If something is competitive, it is probably a global phenomenon.
Exactly.
There are I know of people, and I think Dr. Mala has mentored many people who have actually gotten into surgery also.
Yes.
They have gotten into radiology residency also. So it is possible. It is not impossible, but the numbers would be the challenge, but that would be a challenge in India also.
Yes. You have to accept the challenge and go on. You can't say challenge है इसलिए मैं नहीं करूँगा. It means that you didn't want to do it in the first place, right? So it is, yes, surgical branches are more challenging, but people are getting in, so you can also get in. It's not impossible.
What is any percentages regarding IMG matching into residencies that would instill optimism into the candidates?
Absolutely. So I have a lot of YouTube videos where I have actually shown you graphs of people starting from 2014 until today. So when we were in 2014, it was as low as 35 to 40% of IMGs used to match. And last year, in 2022 match, we had 60% of students who matched. So it is just progressively increasing. 60% मतलब 100 में से अगर 60 बच्चों को मिल रहा है, I don't think that's a bad figure at all actually. And it's all there on NRMP. These are not figures we have made up. You can go on to nrmp.org where they have given graphs of students, international students who have matched, and 60% is quite a big number, I would say.
And when we say IMGs, we don't just mean the Indian graduates, we mean all the non-US.
Absolutely, and
so
apparently Indians are about 30% of the international category. Good number of Indians.
And madam, I would also want to know from you, like you've been following USMLE and the match rates for IMGs for so long. What are the recent trends, and do they instill some optimism in the candidates now? What is the percentage of IMGs who get matched actually?
Absolutely, it's a great question because it definitely instills a lot of confidence in students. I have a lot of YouTube videos where I have actually shown a graphical representation of the students who have matched right from 2014. So we can say it started with about 35 to 40% in 2014, and in the last match in 2022, it's gone up to 60%. Like I said, about 60 people managed to get into a residency, and that's a very, very good optimum figure. So I think if you're optimistic, 60% I think is a very good number.
It's actually very good.
Yeah.
And what I would now try to summarize everything for the listeners. What I have seen is that every student's journey in America is different. America is a big country. It has a lot of different experiences for different people. So what happens is sometimes I see children who will say कि my one senior said this. It may not be true for you, and it may not be true for thousands of other journeys. So that is where people like Dr. Mala come into play, who has seen many journeys and who has actually mentored many journeys. So first, my message to all of you would be, don't base your decisions on one person's journey. And we've actually seen this in our own talks. Me and Dr. Mala were discussing about one particular senior who was telling something to the students regarding when to give the paper, and it actually misguided a lot of other students. Maybe it worked for somebody, but it was not working for the majority. So it's important to know that you are going to be a unique journey in America. It is a very big country. Number two, that I would take home from what Madam has told today, and would be that please start thinking about it early. Give your step 1 early and seriously pass it in first go. Don't have that passed in second attempt in your resume.
Attempt is not good.
And take it seriously. And another thing, a lot of students who have given the step 1 recently, and whenever I've interacted with them, they have said the paper felt more difficult ever since they have made it pass and fail. So please take it seriously. Second is aim for a high step to CK score.
Yes, absolutely. Good CK score will set you apart. At least you will be called for interviews, because initially your computer filters application. So anyone below a certain score will be filtered out. तो अगर आपको call अगर वहाँ से आना है, बाकी interview matters, your letters matter, everything matters. But the first step is filtering out of applications which come with your score. So try to get as high score as possible.
And then having good letter of recommendations.
Absolutely.
And US clinical experience.
Yes,
would matter.
That matters a lot. If, like you told the example of my own daughter, I think the first thing that she was probably in the 4th year when she first decided to go for a clinical rotation to the US. Right from there on, she did her research there in neurology, and I think what really stood out in her application was that wherever she went, she collected good letters of reference, so much so that in some interviews they even read out those letters, and that really sets you apart when someone says that you have done good work. So your work doesn't stop by just getting scores or sending your application. When you go there, you have to make sure your work ethics impress them and they write good things about you. So there are so many aspects of this which we can mentor you, and you need a mentor for this journey, definitely.
And I'm so proud of her journey even as a Damsonian.
Absolutely. He was her biggest mentor actually.
So what we would say, that it is going to be a unique journey for you, and it is important to think about it early, be mentored, be guided, be optimistic about it. Any final words of advice to aspirants?
I would say start early, look for the right people to guide you. Don't listen to every person who comes your way, because like Dr. Sumer very rightly said, completely different journeys. I haven't seen in my last 20 years that two people have the exact same journey. ऐसा कभी नहीं होता है. Everyone has their own unique journey. So don't just believe कि अच्छा इसके साथ ऐसे हुआ तो बिल्कुल मैं वही step follow करके मेरे साथ भी वैसे ही होगा. It never happens. So talk to the right people, be positive. It's very, very important to be positive about your goals, and come to us, come to the mentors, and make sure that you don't discuss your heart out. Your family support is very much important. So get your parents, because your parents need to know what is the thing in store for you, and so many other things. So I think we can always have a lot of videos. As Dr. Sumer was saying, that we can, on our eMedicos app, we will start putting in one-on-one sessions, mentoring sessions, where we can ask students to ask their questions and all that. And we'll do a lot of things so that we can help the students out for this journey. And
even after our best attempts to answer all the questions, still you might have some questions which will be more personal centric, which you would want to answer. So we will leave a WhatsApp number on the screen, which on that, or even in the description of this video, you can send a WhatsApp on that number, and somebody will connect you to Dr. Mala directly, and Dr. Mala will she has been kind and happy to help you out. So we are here to help you. It is important to look at positive examples. There are huge number of positive examples. If you want to do it, we will help you. But the question has to be answered by you in person. We wish you all the best, and we would be very happy to be a part of your American dream.
Absolutely. All the best, everyone.